path to deciding to go to dental school in the first place, and then what was the path to deciding to go into an orthodontics residency?
Sure.
So actually, I didn't really know I wanted to go to dental school until after college.
Okay.
So when I was growing up, I actually was not pressured, but I thought I wanted to do medical school.
Mhm.
And then, and somewhere along end of high school, I realized that's not exactly what I wanted. I didn't want to go through forever in school and then become a physician.
Mhm.
And I guess that's a kind of a cop-out, but I decided that I wanted to be a businessman instead. And so I studied finance and accounting in college, attended University of Maryland, College Park. Graduated and started working for a firm called Deloitte & Touche. And for some reason, I just didn't really like it. Just didn't like the interactions that I had with people. I just didn't like the lifestyle of business. And so I kind of tried to think about what I really wanted to do with my life for the rest of my life, and started thinking about medicine again. Kind of went through that whole process and decided, okay, that's still not what I want to do. And I had some family in dentistry, and they seemed to love their life, and so I kind of looked into it a little bit more.
Mhm.
I thought that it would fit my goals for what I wanted to be, what I wanted to do, what I wanted to achieve, and I guess sort of started going for it. And then, took some post-bac classes, went back to college, took some classes that I needed for science, and then applied to dental school and then went through it. As I was doing dental school, I really didn't know what kind of dentist I wanted to be. I think, for the most part, I wanted to be one of the super general dentists that just do everything, and do everything really, really well. And so that's kind of what, I kind of went through the first 3 years thinking that I was going to do. But still, in the back of my mind, just kind of leaving things on the back burner, possibly considering, some sort of specialty, things like that. And so, just worked hard, obviously, to keep everything open. And somewhere along the line, in third year, we don't get too much exposure to orthodontics necessarily in dental school. And that's a lot of complaint that people have as they go through dental school, that there's not much exposure to it. But at Maryland, which is where I went for dental school, we had to do some sort of shadowing and assisting in the ortho clinic. And just the interactions that they had with their patients, it seemed like something that I would enjoy for the rest of my life. I mean, I really, really wanted to do reconstructive things for patients, do whole mouth rehabilitation, things like that. But a lot of the interactions that I had in the general dental clinic in school just wasn't my cup of tea. I mean, sometimes you end the day and you're just exhausted. Sometimes patients aren't appreciative. Sometimes patients complain. But in orthodontics, I really didn't see too much of that. People want to be there. The patients want to be there. They know that this is kind of an elective treatment, but at the same time, they have seems like a profound impact as they go through treatment. And most of the patients in orthodontics, in my mind, are, I guess they are younger, more impressionable. And I just felt like we could have more of it, or I can have more of an impact, possibly, with the younger population. That's kind of more moldable, and kind of make a bit more of a difference. I mean, it's not all altruistic motives, but there is part of that there, and I thought that it would fit the lifestyle that I wanted a little bit more, and so that's kind of my path, I suppose.
Do you still think that?
I do. I mean, I think starting, like I said before, we don't get that much of orthodontics in dental school, and coming here and doing residency, I think everything that I thought it would be, kind of is what I thought it would be, and so I think every day is it's great. You leave and you feel like you did something positive. There's rarely any times you go home and you feel like you're just worn out. I mean, it's a good situation for sure, and so I'm definitely happy with the way things have worked out. So yeah, I couldn't be more than pleased.
Good.
I was a little similar to Robin, but a little dissimilar. I kind of always knew I wanted to be a dentist, and it was interesting when I would try to tell that to my parents, because we don't have any dentists in our family or anything like that. But I shadowed our he was actually a prosthodontist, but he was our family practitioner because I was from a little bit smaller town. And I had a great time there and just loved the interaction he had with his patients and, you know, the lifestyle that he could live. He had a big family, really big family man. So I thought that's kind of the lifestyle that I wanted to, and working with, you know, a nice science and blend of science and art. I think dentistry just really, in every aspect, whatever specialty you go into, you're going to have to deal with that combination. And that's always been something that interests me. So I kind of knew that going into college. Actually, probably from like freshman or sophomore year of high school, I knew I wanted to be a dentist. And then once I got into dental school, for a very long time, I thought I wanted to be an oral surgeon. And then probably first and second year, I wanted to be an oral surgeon. And then as I got to learn a little bit more, like Robin said, you don't get a whole lot of clinical exposure to orthodontics. But as you get to shadow and you get to ask people, you know, can I just come in and observe you? And I just thought you could do the coolest things in dentistry and orthodontics. So that's why, and I'm also a bit of a big kid. So if I get to hang out with people my own age for most of the day, I'm fine with that. At least my wife would tell me that.
So what are those coolest things?
You can, the appliances we use, and jump in if you, I mean, to rotate an entire jaw, you know, upward like that. I know you can do that in oral surgery, but to do it without a big, I guess it would be an intensive treatment like that. And the mechanics that we use to push an entire, you know, sets of molars backwards and to get all the room that we need to expose canines, bring them in. I think that's some of the coolest things we can do in dentistry. And I think our patients are also, like Robin was saying, they're very grateful for that towards the end of treatment. So that's why I chose orthodontics. I knew it was either going to be pediatric dentistry or orthodontics for me. After I got to see what you can do in both of those specialties.
I mean, just to jump in just a little bit, he kind of alluded to it. One of actually the big reasons, and I actually wrote about this for, you know, application to ortho, is everything else in dentistry is going to be something that you're doing because people have not taken care of something, and then you need to take away structure or something along those lines and kind of intervene in order to make things better. In orthodontics, I think the cool thing about it is since these kids are so young, their teeth are nice and fresh, really you're doing a very minimalistic thing and hoping that, you know, that's going to help them out for the long term. And so, you know, everything in dentistry these days is going toward doing the least you can possibly do, least invasive, is what everyone always harps on. And I think orthodontics is the epitome of that. And so, you know, if we're able to, you know, we see patients maybe just 2 years of their life regularly, but hopefully if we're able to make an impact during those 2 years, then, you know, yeah, there's debates on this, but maybe they'll take care of their hygiene as they grow up throughout life, and I think that's fantastic. So.
It's a very cool 2 years that you get to treat your patients to. When you take your initial photographs and you look at the befores and the after, I mean, they're an 11-year-old, you know, tween or whatever it is, and by the time they're out, they're 13, 14 years old, and they're, you know, you can see they're young adults at that point. It's a really cool transformation that you kind of get to ride along with your patients on that ride too. So I like that too.
What about the process from going into dental school and then into residency? What would you highlight the differences of interviewing, applying for a residency program that was different, maybe that surprised you, that was challenging?
I'll go first on that. I think the biggest, to start off, I think they're very similar processes.
Okay.
You know, you can do a blanket application and kind of, you know, send out all those communication lines to different schools that you want to go to. I think the biggest thing in residency is, the biggest difference is that in residency, you are looking for kind of a setup for later in life as well, or you're looking for, I guess it's hard to explain. I think you grow a lot in dental school, and you kind of figure out where you want to be and what you want to have, that kind of end goal, where you want to be. And I think in residency, you choose your schools based on a really good stepping stone to get to that end point. in choosing to go to dental school, I feel like it was a little bit more like college. Like I figured I could do 4 years here, and then, you know, I can go wherever I want to after that, because I'll define my endpoint when I'm in dental school. So I don't know if you agree with that or disagree with that, but residency for me was very, very much a stepping stone to that endpoint that I determined throughout dental school. But
So I guess the question was it, how is the
Process.
application process a little bit different?
Mhm.
And then how is residency different than dental school? Is that what you were wondering? Well, yeah, I mean, definitely what he said as well, but in terms of just the application process, like he said, very similar to begin with, but then very different in the outcome. I'm sure you're familiar with the whole pass and everything like that, so,
in match.
yeah, and match. I mean, dental schools, you apply to whatever number of schools you decide you want to apply to, and then you get as many acceptances as you can get, and then you pick one of those. I guess one of the things about residency, like it could be good or bad, but the difference would be that you get kind of told where you're going to on match day, and you know, you can rank all the interviews that you go to as well as you'd like, but in some way you're kind of at the discretion of, I guess, the match system and how things work out. So, you know, in many ways that's a good thing, but in many ways it's also kind of frustrating at the same time, because you don't know exactly where you're going to end up. And then on that day, you kind of figure it out, and it could be the best day of it's going to be the best day of your life either way. But there's a lot of surprises that can happen. So I think that would be the biggest difference with the pass match versus dental school ADSAS type applications. And then for residency, kind of like he was saying, I mean, this is going to be the end of the line, I guess, for all of us. Dental school, you can decide, hey, okay, I want to be a general dentist. I can do some sort of regular general residency, and then maybe decide what I want to do later. But then for us, there's nothing else after this.
It's
So
your niche.
yeah,
that's
it's
where
the
you're gonna be.
it's the end, and that's great and exciting, and at the same time a little bit scary. And so you really do have to get on the ball about where am I going to be afterwards. You know, what am I going to do? Am I going to associate? Am I going to set up my own thing? How am I going to live the rest of my life and make a living? And the definitiveness of that, I would say, is just a little bit different than just coming out of dental school. Also, in residency, I'd say that you definitely have a lot more independence. You have a lot more responsibility to make decisions kind of on your own. There's definitely professors and faculty looking over and helping you out, but I think we are at this point all licensed to practice dentistry, to make treatment decisions, and I think a lot of that decision making falls on our hands, as opposed to in dental school. Obviously we make decisions and stuff, but there's a lot more hand holding and kind of nurturing that happens in dental school, and that's great that we get, I guess, a lot of the end say in how things happen, rather than kind of being told, no, we have to do it this way. Just being a little bit more of a colleague situation with our faculty, rather than being just a student-teacher type of relationship. I think that's awesome, and definitely one of the biggest differences between dental school and residency. So
I think, dental school is very, very didactic. There's a teacher at the front, and you have, you're going through lectures and whatnot. When residency is a little bit more like a seminar. You're discussing with people, talking to people.